I'm a surgeon and I'm a writer. My writing has become the way that I can focus in and begin to understand the problems that most confuse me. One case in point was a piece I wrote called Letting Go about a woman named Sara Monopoli who might help take care of, who was diagnosed with stage 4 lung cancer during the 9th month of her pregnancy at the age of 34. This was one of the most difficult circumstances. You have a young woman with a brand new baby. Of course, everybody is fighting for every chance that she's got. She was young, she was enthusiastic, she wants to tackle this. You don't want to be the downer. So you're grasping for a straw that says, well, there's something here that's going to be beneficial. Stage 4 lung cancer, we know it's not curable, but suppose she's the one that somehow gets cured. Maybe she's the one. And so therefore we should do all these things to her. Having any kind of discussion that would begin to say, look, you probably only have a few months to live. What do we do to make the best of that time without giving up on the options that you have? That was a conversation I wasn't ready to have. I don't think any of us were.
Hey there.
Dr. Gawande, how are you?
How are you?
Come on in.
Take me back to when she's pregnant, she's doing great.
Yep.
39 weeks, your due date is coming, and
The collapsed lung would not allow for a C-section. It was too dangerous to be opening her up with all that fluid buildup. So Sarah had Vivian basically pushing with one lung. It was so difficult, but she had the baby. You want to be part of that 15% that survives more than 5 years. You want to be that part of that group so badly. Yeah. And you say to yourself, why not us? You know, it wasn't about how can we have good days to the end. We didn't focus on that enough. We're trying to stabilize the situation and try to become spend a little bit of time as a family. But it was an impossible situation, impossible summer. It was just excruciating.
when I came on the scene was when she got diagnosed with a second cancer. You know, in my mind, what I was thinking was I wouldn't offer this surgery because the lung cancer is gonna take her life. And yet I didn't feel I could say that to you all. I think we started talking about the experimental therapy that you all were hoping to get on for a trial with the lung cancer. And I remember saying something I sort of regret, which was, you know, maybe that experimental therapy will work for the thyroid cancer too. I said that, and I know it was complete.
Well, you had joined us in our sunny disposition, hoping for the best.
I knew it was not gonna. I mean, in other words, the reason I regret it is because I knew it was a complete lie. I just was wanting something positive to say.
I did not know it was an outright lie. You could lose your license for that.
I know. But I think I don't think I was terribly equipped for having that conversation. And maybe you all weren't.
I don't think we were. I've thought often about what did that cost us? What did we miss out on? What did we forego by consistently pursuing treatment after treatment after treatment, which made her sicker and sicker and sicker?
The very last week of her life, she had brain radiation. She was planned for the experimental therapy the following Monday. You woke up and she wasn't doing so well on a Friday. What happened then?
So she woke up and was gasping for air, and I tried to crank the oxygen up. I said, let's max this thing out. Maybe we can get a bigger oxygen machine. We were so close to getting to the next potential fix. And she said, I can't do this. I can't do it at home. I'm too scared. I'm gasping for air, and I can't do this. We should have started earlier with the effort to have quality time together. The chemo had made her so weak that she couldn't hold Vivian. It was exhausting. And that was not that was not a good outcome for the final months.
Yeah.
It's not where we wanted to be.